Hi, good afternoon, everyone. I know people are slowly streaming in. So welcome to Asia Philanthropy Circle's online launch for our Regional Early Childhood Development Landscape Study. I'm Stacey Cho, Chief Operating Officer at APC, and I will be your host for today's event. For those who are new to this research, it has been years in the making. This is supported by 12 foundations who are actively working in or funding work in this region on early childhood. Before we start the program proper, I would like to acknowledge all the foundations for their patience and commitment. So in alphabetical order, we have Ayala Foundation, Bhakti Barito, Jarum Foundation, Ishq Toleram Foundation, Knowledge Channel Foundation, Lee Foundation, Lim Foundation through the Center for Holistic Initiatives for Learning and Development, Numuro Foundation, Ramon Aboitis Foundation, Quantage Advancement Initiative, Tanoto Foundation, and last but not least, Zulik Family Foundation. You will get a recap of these organizations later, and you can also go to our website and refer to the research page and download the report for more information. Right. It has been a while since we had an online event with such a big audience, so let's begin with some housekeeping instructions. Because we will be going into the country breakouts towards the end of this event, if you are invited and confirmed for these sessions, please make sure that you identify yourselves with your name, organization. Otherwise, we will not be able to put you into the right group. And the main session will end after the presentations at around 4:50 p.m. We have more than 200 attendees registered today. I know we have more streaming in as we speak. So please do mute yourself to reduce noise distractions, or we will be muting you on your behalf. If you have questions for the speakers, please type into the chat box so that I can see them, or raise your hand. I will be moderating these questions. Lastly, we are recording and sharing the main session, but the closed door country breakouts will not be recorded. So let's go into the program for today. We are going to kick off a background introduction with the background introduction from Tanoto Foundation. Then the main feature for today will be the presentation of the research findings by our partner, Center for Evidence and Implementation. After that, we have invited Van Leer Foundation to share with us their unique perspective of changing cities and the approach towards ECD through their decades-long experience in this area. Last but not least, we have the Center for Holistic Initiatives for Learning and Development, who will share with us their insights on turning research into policy and practice. The main session will end after this, and those who have registered for the country breakouts will be automatically assigned to their respective countries, and we will return after that for a shareback before closing at 6 p.m. Singapore time. As usual, it is a very packed program. But for those who are not familiar with APC, I'm giving a quick 1-minute introduction to set the scene. So Asia Philanthropy Circle is a network of funders across this region who are committed to working together to make Asia better. We currently have 57 members. Next slide, please. We currently have 7 members across 13 markets with a weightage across Southeast Asia. Next slide. We convene our members together in a safe setting to learn, collaborate, and fund projects towards a better Asia. So that's it. I hope that was succinct enough for you, because I do not want to delay further. Next slide, please. And we'll now pass the time to Dr. Satrijo, CEO of Tanoto Foundation. Tanoto Foundation was actually the spark that started this whole research collaboration. So we are pleased to have Satrijo share with us on their reason to do this and the journey since. Satrijo.
Thank you. Thank you, Stacey, for the introduction. Ladies and gentlemen, honored government representatives, good afternoon. Thank you again for giving the opportunity to me to address you today. Early childhood development is a subject that is very dear to what Tanoto Foundation does. And it is also very close to my heart. And also one that is extremely important for our region. Various studies have highlighted the importance of investing in early childhood development, especially during the first 1,000 days, to create a strong foundation to help our children to achieve their full potential. In December 2021, about 18 months ago, a report from UNICEF titled Growing Steady and Strong validated the need to nurture young children in a holistic manner, putting emphasis on caregivers and service providers, and recommending that the nurturing of young children should start during pregnancy, in fact. Mothers are to receive all the necessary support and services to secure a safe pregnancy and delivery. Babies should have a protective and healthy environment, while when they become toddlers, and young children should also be nourished, protected, and ready to learn. Ladies and gentlemen, that sounds very cliche. Yet, in the Asia-Pacific region, for the larger community, this is not widely known yet. The good news, though, is that across the region, there have been significant improvements in policies and the provision of programs supporting the needs of young children, also for mothers and also for their families. However, there is insufficient understanding of the full landscape of available policies, services, and programs for young children and families. Even strong ECD systems can have gaps, meaning that children and families may not have access to the intervention that they need. For example, education intervention programs in Indonesia are often challenged by accessibility and infrastructure. Children in big cities enjoy easy access to schools and daycare, but the same cannot be said for those living in rural areas. You can see similar disparity in China, where many children are left behind in rural areas in care of grandparents or the caregivers, while their parents actually are working in the cities. This is why this study from Asia Philanthropy Circle is so important, it's critical, to better understand the ECD landscape in 4 countries, China, Indonesia, the Philippines, and Singapore. As you will hear later, this study has been done to provide comprehensive information to stakeholders about what ECD policies, programs, and services are currently provided in each of those countries, but also to identify any gaps in the system in each country and possibly across the region. We are seeing a lot of energy and interest among stakeholders across the regional ECD sector in enhancing programs, services, and policies that will improve the life outcomes for young children. The result of this study will help stakeholders, you and me together, but particularly for donors or philanthropists, to identify where new or enhanced programs, policies, or funding may be required to better or to enhance ECD and support children and families in need in those 4 countries. This is why we initiated and support this research to better understand the needs of early childhood development systems in the region. The objective of this research are aligned with our own efforts in Tanoto Foundation, that is to catalyze support for initiatives that promote quality early childhood development. We look forward to collaborating further with like-minded organizations to support early childhood development programs across the region. I would like to thank the Center for Evidence and Implementation for conducting the study, Asia Philanthropy Circle for coordinating the participating organizations, and of course, the like-minded organizations who have collaborated together on this research. Thank you very much and enjoy the whole afternoon.
Thank you so much, Pa. What I want to say, though, is that we are so glad of our members here at APC who are very strategic in understanding the impact that such open source research can have for everyone. We will now go into the main highlight of today, and we'll be inviting our research partner from CEI, Mary Abdo and Esther to present the key findings and recommendations of this landscape study. So Mary, over to you now.
Okay, thank you so much. And thank you to Stacy for the kind introduction, and to Pak Satrijo for laying the context for this important work. I will just go very briefly through a first set of slides, and then we'll turn it over to my colleague Esther, who is our lead author on the study. And then I'll be rounding out with some cross-cutting recommendations that we have found. So let's just dive in, and we can move on with the slides. So first, we'll structure this discussion. We'll just provide a quick introduction to the study. Esther will be sharing some of the key findings in each country, and also we'll be looking at across the region some of the key insights. And then we'll look at a set of cross-cutting recommendations for the region as a whole. So if we look at the 4 study countries, what are some of the things that we can say that are important across the region? Let's move on. Just a quick introduction to the two of us. My name is Mary Abdo. I'm Managing Director at the Center for Evidence and Implementation. I was a contributor to this research. And then we have my colleague Esther, who is an advisor at CEI and was the lead author. But it's also really important to note that we're many participants unable to attend today, or who may be in the audience and are not sharing as presenters today, who played a significant role in this research, including not least our study lead, Dr. Gayatri Kimbavitam. I also really want to acknowledge and say thank you to the advisory group members who played such a vital role in the study and shaping the work along the way. We did have an advisory group comprising the organizations that Stacey mentioned at the beginning. They joined monthly discussions about the research findings as they emerged, provided invaluable advice and insights, recommendations on people that we should speak to, and were really vital to shaping the study outcome, including reviewing many drafts. So we hugely appreciate their support. And I also want to acknowledge the 50+ interviewees that we spoke to along the way, who provided hugely important insights on their country and provincial contexts. So we thank all of them for their contributions. Move on. Just again, as Stacey did, I'll do a quick introduction to CEI for those who may not know us. We are a global social purpose organization. We're a not-for-profit. We have a base here in Singapore that works across Asia, as well as doing quite a lot of global work on philanthropy. We got started in Australia in 2015, and we are a mission-driven organization that works to get the best evidence implemented in policy and practice to improve the lives of people facing adversity. Move on. I thought I would quickly give you a little background on this research. So Pak Satrijo and Stacey have also provided some good guidance here and some good insights. We know that there have been really, and you'll hear this throughout the presentation, and if you deep dive into the report, you'll see this as well. There have been this period of really tremendous transformation and important improvements in policies and programs supporting the needs of young children and their parents across this region. We probably the last 20 or 30 years have been this incredible period of growth and change. However, there are really key gaps in our understanding of what that landscape looks like. And the lack of understanding that we have, which is in part a product of the tremendous growth and transformation that has been in place, is that this can hinder the collaboration and the potential for impactful action. And so this study was made possible through this anchoring support from Tanoto Foundation and from our collaborators at the Center for Holistic Initiatives in Learning and Development, and of course the leadership of Asia Philanthropy Circle. Can move on. Next slide, please. And so why is a landscape study in these 4 geographies important? So we know that even the strongest ECD systems have service policy and programmatic gaps. So families may not be able to access the services or information that's important to address their needs. And we also know that there's not comprehensive research that provides this landscape assessment in any of these 4 countries. And so findings of the study will support funders and wider stakeholders, including policy and practice communities, to be able to make more informed strategic decisions and to be able to make evidence-backed choices about their program delivery and scaling. And we hope be able to take the really powerful force that is philanthropy and its potential to be catalytic to be able to expand expand and accelerate the opportunities for young children and their parents in the region. Let's move on. So just a little bit about the approach and the methods. We had these 3 core questions. What parenting and ECD programs, services, and policies are currently being implemented across each country aimed at families with children between 0 to 6 years? What gaps currently exist in the ECD program provision in each country when mapped against international frameworks? And finally, what evaluations have been undertaken of ECD programs and services? And so over about a 12-month period, we conducted expert interviews, undertook a systematic desktop process to identify the policies, programs, and services in each geography, undertook a search for available evaluations for each of the programs, and then undertook expert review and feedback, both with the advisory group and in some cases with external reviewers. We can move on. We also think it's important to note, you'll see this come up as a guiding principle in the way that we provide this, this sharing today, is that we were lucky enough to be able to draw on 2 of the major frameworks in early childhood, which have emerged in the last decade, and where we think it's really important that where we have these strong frameworks, we are using a common language as a global community when we talk about early childhood. And so we benefit from both the Nurturing Care Framework and also the World Bank 25 Key ECD Interventions Framework. So both of these played an important role in the study, and Esther can speak more to their application in the sections to come. Let's move on. So Esther, over to you.
Thanks, Mary. So looking at the findings, I'm going to first go into some of the regional findings before then going into each of the 4 countries in a little bit more detail. I think later on, for those who are joining us in the closed door session, we'll go into much more detail here. Across the region, it's really important to highlight here that there's been such a shift in what's happening across all 4 countries. We have observed some major advances that benefit children and young and families across the region. At a community level, we see that there is a much stronger focus on children, families, and how they are viewed in their immediate communities. At a programmatic level, we observe more attention on equipping caregivers with positive parenting practices. This is really in tandem with that global shift that we have towards responsive caregiving. And on a policy level, we see across all 4 countries increasingly investing publicly in the early years. This is also further bolstered by increasing private philanthropic funding. On the next slide, at the same time, we do see that there are some common needs across the region. Firstly, there is a lack of up-to-date and reliable data. Across the countries, this has been a challenge to varying degrees and in different areas. Interviewees have highlighted that better data really would help enable better action. However, when it's not being collected or reported robustly, these inaccurate numbers and pictures are being reported and treated as fact, often leading to some seemingly poor decision-making. Some examples of data that's not being collected are related to, for example, the percentage of early initiation of breastfeeding, the quality and frequency of caregiver and child interactions within the home, or even around maternal well-being and mental health. Another area here is on the absence of localized research evidence and evaluations. we see that the percentage of programs that have been evaluated vary, they're publicly available, vary between 10% in one country to 40% in another. That's roughly the range. And also to highlight, only one evaluation across the 4 countries in Indonesia include an analysis of cost effectiveness. This means that most of the programs that we've surfaced are either not being evaluated or the evaluations are not being made publicly available. This prevents us from really having the most important information we need to make informed decisions about how to scale up a program, how sustainable it is, or whether it requires any form of modifications at all. And lastly, here we see a lack of focus on caregivers beyond mothers. We're talking about fathers and also grandparents or other non-parental caregivers within the home. As women are increasingly participating in the workforce, and in some countries, there are high levels of internal migration for job purposes, then the role of fathers and grandparents become even more important, and there is a need for both policies and programs to support this group. So to kick us off into country findings, I'm going to start with China. We are going in alphabetical order, just so that you know. In China, there has been an increasing commitment in the early years landscape. I do want to say at this point that we really want to acknowledge our research partners at Nanjing Normal University. I think they're here with us in the call. They'll be joining us in the breakout session later, but they have been really crucial and integral to our research in China. So going into what's been working, right? In China, we are seeing consistent progress in addressing nutrition, stunting, and wasting. We're seeing a comprehensive set of policies to promote basic maternal and child health care, including specifically in immunizations. We're also seeing increasingly funding and support for early learning programs and really generous maternity leave provisions. The challenge in China, though, is how can we get these national policies implemented well in provinces and villages, and also to ensure that programs are delivered with quality to support young children, families, and the workforce around them. The next slide. When going deeper into what the most urgent needs are, we look at 3 big things around nutrition, health, and safety and security. In nutrition, we see that despite the strong progress that has been made, young children in China are affected by both undernutrition and stunting, and also rising rates of overweight and obesity. This is not uncommon, though, in rapidly developing countries, as I'm sure most of us would have seen in other countries. There are also key differences across urban and rural geographies. In particular, in China, many mothers are not breastfeeding their infants, choosing instead to use formula milk. This has an impact on under and over nutrition at that age. To address this, the study has surfaced a few actions, including strong support and action towards the promotion of exclusive breastfeeding. How can we work with community partners to increase access to physical activity spaces and opportunities? And also, how can we work with existing local services to understand the reasons behind malnutrition and stunting, and then work with them to address this gap? Secondly, we see that there can be a greater support towards caregiver mental health and well-being. This is an underserved area across the region, with awareness and consciousness towards its issues increasing over the last few years. So within China, a few of the policies and programs identified have focused on mental health or well-being of mothers and caregivers, or provide the necessary support. What we can do, though, is to ensure that we conduct more research on the state of maternal mental health in China, and also consider how we can collaborate and work with existing service providers who are seeing mothers and caregivers, and then provide the requisite support there. Lastly, we do see a need to improve the protection of migrant and left behind children. In China specifically, birth registration is linked to the home province of the parents. Hence, it sometimes makes it difficult for vulnerable children and families to access the services and protection required, especially if they have moved within the country for work or financial reasons. Thus, it's crucial then for us to increase our understanding of why children are not being registered and how we can work with local governments to identify vulnerable children and families, and then to coordinate the provision of additional support to meet their needs. In the next slide, when we look across, or when we take a step back and look across the 5 nurturing care components, we see a number of cross-cutting opportunities. Firstly, we see the need to retain and train the early childhood workforce. And when we talk about the workforce here, we're not just talking about educators, we're also talking about community health workers, social protection, social workers here. There are a number of programs that train their staff, but this is primarily to roll out a fixed curriculum or service. So there is space here for us to understand what are the barriers and facilitators to retention, and also to work with local partners to develop evidence-based training content. Secondly, we see the need to improve coordination across sectors. This goes a long way to streamline efforts, utilize resources efficiently, and ensure that families are not confused and within a complex system. This absence of coordination has led to some overlaps in service provision and also gaps in other areas of service provision. Here we see opportunities to work with community-based providers to identify ways to improve service coordination, and concurrently then working with local government to identify these gaps and to improve and increase efficiency of the use of resources. Lastly, we see a need to strengthen data-driven decision-making. This was noted earlier as a regional finding as well, and it does affect the countries within this study in different ways. Within China, we see that at a programmatic level, we can find ways to ensure that we have robust monitoring and evaluation frameworks in place. And also, we can work with research teams to identify priority areas within the country where data is urgently needed. Moving on to Indonesia, the Indonesian government has demonstrated a strong commitment to early childhood development. We see this in the strong policy focus, the number of programs that are available for vulnerable families in areas of nutrition, health, caregiving. We see this in the presence of a funded national health insurance system, and across national and local levels, we see that early learning is strongly encouraged, both in formal and informal settings, with government support and funding. Additionally, child protection programs are readily accessible, and interestingly, these are often bundled with other areas of support, such that parents have fewer touch points to get to. The challenge in Indonesia is really about how we can bring more resources and capacity to support local implementation, such that the goals within the national policy agenda can be met. Moving on to the most urgent needs within Indonesia, these are centered around nutrition, early learning, and caregiving. In nutrition, we are seeing that while Indonesia has a very aspirational goal of reducing stunting to 14% within, I think, the next year, to achieve this, much more really needs to be done in an accelerated manner. So in this sense, we are thinking about how can interventions that exist be leveraged such that families can access them at a more timely manner, and also how we can promote the use of locally available foods, build up the capacity of district and village level health workers, and examine which programs are most suitable for scaling up. Secondly, we see the need to enhance the home environment. Very little is currently known about the home environment for babies and young children in Indonesia. This is also true of other countries in the study, and you would hear that come up later on as well. Most of the early learning opportunities in Indonesia are catered for children above 3. So there is a gap here and a need to consider how adequate care can be provided to younger children from 0 to 3, and how parents and caregivers can be equipped with sufficient knowledge on stimulation and child development. What are the touch points here that we can leverage on? Lastly, we see a need to focus on fathers. In Indonesia, I know that recent legislation has brought paternity leave entitlements to much closer to international standards, but it's unclear right now to what extent this is currently being implemented in practice. As many women are working formally and informally within different sectors, it's then critical to gain a more in-depth understanding of how fathers are engaging in caregiving and how they can engage in caregiving. Within this, we see that there's a need to support research activities to understand the role of fathers within the Indonesian society. And now, taking a step back to look at cross-cutting opportunities, again, we see the need to expand workforce training. In Indonesia specifically, we are talking about how we can work with local partners, some of whom are here with us in this call and have supported us throughout this study, who have been developing evidence-based training content, and how to bring this up to scale when we have that evidence-based training content. Additionally, how do we work with national partners then to increase that access to training across a variety of early childhood workforce professionals? Secondly, we see a need to increase coordination of civil society. Very uniquely in Indonesia, you have such a thriving civil society space with numerous local and international NGOs working across the various nurturing care framework components. However, from our interviews, we noted that there was an absence of coordination across philanthropic and NGOs. So this has led to overlaps in service provision sometimes, creating access in some areas and gaps in others. What we can do then is really consider how provincial level coordination might allow for concerted discussion and collaborations, and also then support the inclusion of district governments to strengthen public-private partnership. Thirdly, we see a need to provide quite targeted support to local governments. In this way, for most of the policies in Indonesia, they are being implemented by local governments at district and provincial levels. So what is the support that we can provide for them? What capacity needs to be built up amongst local government officials to first understand the importance of ECD and then identify the needs within their communities? And finally, then to increase very meaningful and targeted support for young children, mothers, and families in their communities. Next, we move on to the Philippines. Within the Philippines, we see that the country is on track right now to meeting the SDG, the Sustainable Development Goal targets for exclusive breastfeeding by 2030. We see that universal health coverage is prioritized by the government, especially with the lowest income groups receiving much more support. Educators are also being trained, and there is a push for best practice in early learning to be disseminated across local government units. Finally, there are also a number of programs that we've surfaced in our study that show that they are equipping mothers and fathers with the relevant knowledge on parental skills, on caregiving skills. The challenge here, what needs to be done, really is how can we build on the knowledge of what is working and then scale it to the areas that need it the most. Moving on to the next slide, the most urgent needs within the Philippines are around 3 areas. We see here again the need to reduce the double burden of over and undernutrition. For the Philippines, again, it's the issue of stunting in some regions and then overweight and obesity in other regions. There are existing programs though within the Philippines, and these programs should be further examined for its feasibility for scaling up. And there's also a need to understand the barriers and facilitators that families face to provide adequate nutrition and healthy foods to young children. Secondly, we need urgently to address the barriers to accessing immunizations. Childhood immunizations in the Philippines, unfortunately, are decreasing due to, one, the inaccessibility to remote areas in the country, and two, an increasing sense of vaccine hesitancy. So how can we work with existing service providers to identify ways to expand or reimagine routine immunizations and to bring immunizations to families? Two, how can we work with local government to increase health campaigns to address this hesitancy and to raise awareness of vaccine benefits? And thirdly, here we see a need to promote positive and responsive caregiving practices. We note that despite the delivery of numerous parenting programs, there has been few shifts in approaches to parenting within communities. From the expert interviews, it's clear that much more support is needed for us to critically review how to shift the parenting practices in order to support that authentic move towards responsive caregiving. This needs to be done really in tandem with local researchers and behavioral scientists to understand the barriers to positive parenting, and then take these set of learnings and incorporate them into existing programs right now. Next, we look at cross-cutting opportunities. First, we see a great need to build local knowledge base, to build up the local knowledge base. This, again, is something that is important across the 4 countries, but specifically for the Philippines, we see a lack of detailed understanding of the country's context and the impact of specific policies and programs. So this local knowledge base would really include an understanding of the cultural contexts that are unique to the Philippines and the needs of very specific minority populations. By having a much more in-depth understanding of these populations, then we can, together with local government units, provide more targeted support and build authentic connections. Some of the key knowledge gaps here are around the economic cost of not breastfeeding, the impact of the expanded maternity leave coverage, and lastly, an understanding of parental attitudes towards daycare, towards childcare. Secondly, we see a need to build local government capacity. Within the Philippines, we see that there is a persistent barrier to the strong implementation of quality programs. One of the barriers really is the capacity and capability of the local government unit. In the Philippines, there is a decentralized model of governance across the country, and hence the quality of nationally developed programs is dependent on the priorities and resources of the local government unit. Hence, there's a need to work with them to truly understand their capacity and needs, and then to support them in building up that capacity within their teams in relation to early childhood development. And thirdly, we see a need to strengthen data-driven decision-making. Again, I've talked about this earlier in other countries, but for the Philippines, we note that there are no periodic national surveys that collect household data. This means that in the Philippines, we don't necessarily know what's happening with early childhood or what's happening within the homes at regular time points. Additionally, many local government units also have outdated data collection and monitoring methods. So here there's an opportunity for us to first make sure that the programs we fund have strong monitoring and evaluation frameworks. And two, how can we work with local researchers to identify priority areas where data is most urgently needed? Finally, I come to Singapore, where there is broad coverage and service provision across the sector for families and children. In the last decade, we have also seen sustained and increasing funding to improve access to and the quality of childcare and formal early learning opportunities. There are high quality and rigorous local research, including more than 6 ongoing cohort studies right now. And in Singapore, there is comprehensive universal healthcare system with easy access to services at low or no cost. One big opportunity here is how can we understand what works in Singapore and how we can then bring these very valuable insights to enhance policies and programs right now for all children and families. Most urgently, in the next slide, there is a need, firstly, to reduce childhood obesity and to increase breastfeeding in Singapore. The rate of childhood obesity has increased, particularly over the last few pandemic years. While the underlying factors are complex, some factors include poor nutritional intake and an increasingly sedentary lifestyle. At the same time, we really don't know enough about the state of breastfeeding in Singapore. Hence, it's crucial for Singapore to tackle both issues concurrently by potentially supporting non-health related innovations to address and are supported and encouraged to breastfeed. Secondly, we see a need to focus on non-maternal caregivers. A large proportion of young children in Singapore are cared for by grandparents and other non-maternal caregivers, sometimes domestic helpers within the home. Enhancing their caregiving practices will only serve to benefit young children. This is in tandem, of course, with encouraging fathers to utilize their paternity leave provisions and to be actively engaged in caregiving responsibilities. Finally, the set of cross-cutting opportunities in Singapore, we see a need to coordinate across systems and providers. Singapore, as we know, has a pretty comprehensive set of programs and services for families. This has also then led to numerous complicated systems across different sectors with multiple entry points depending on when you approach different services. Some of the experts interviewed for the study noted that families often face challenges in navigating that service and the system, especially for families who are already time poor. This adds a layer of complexity to access services that are most meaningful for their needs. So much more here can be done to either simplify pathways or to work with partners to develop something that we like to term navigation aids to support families in understanding the system. Secondly, we see the need to retain and train the early childhood workforce. In Singapore, much has been done in the last decade to develop and implement professional standards and career pathways. This has primarily been for the early childhood education workforce, and there are still gaps existing for other professions in social work, in learning support practitioners, and even within maternal and child health nurses. Additionally, there is a high turnover and attrition rate across the sector. So while the issue is not unique to Singapore, local research is needed to really understand the factors that lead to low retention rates, and then also how we can work with local organizations to support professionals. Lastly, in data-driven decision-making for Singapore, there is a lack of quite specific early childhood data at both national and programmatic levels. One example is data on the initiation and sustainment of breastfeeding. In the expert interviews, they've highlighted also a need for a coherent long-term outcome monitoring system for the sector that currently does not exist. This would go a long way to support the work of professionals who interact directly with children and caregivers to understand the impact of their service provision and then to address the gaps in a timely manner. Right now, I'm going to take a break and go on to cross-cutting recommendations, which Mary will walk us through.
Thank you so much, Esther. I will zip through this because Esther has already spoken about quite a few of these in the course of providing the insights about each country. So if you have a look at the report, I'd encourage you to look at the executive summary. It provides a very strong overview, and then you can dive into the areas that are of most interest. And what you'll see is that there are these observations and insights about each geography and about the strengths and the opportunities within each of those, and some quite specific recommendations for donors within each geography. And then there's observations provided about the region as a whole. And of course, the study countries are extremely diverse. So the findings about the region as a whole are really about the kinds of ecosystem elements that seem to be, that need strengthening in the region. I think we could probably do the same study in other parts of the world and find many of the same messages are coming through, because we are seeing these patterns of you'll see as we go through, some of the patterns that we see here in the region are exactly those that we'd see echoed in other places. And so these provide some guidance to actors who are working at a regional level, or where donors are interested in doing collaborative work across the region, or those that are interested in strengthening this ecosystem within the region to be able to take action. So let's move on to these recommendations, and I'll go through these quickly, and then we'll move on to some questions. I know you'll probably want to dig into some questions for Esther. So first, as Esther said, the question of data and the availability and use of data that's accurate, linked, and readily available to stakeholders and system actors, this is a worldwide challenge, and one we see being taken on in various geographies, whether it's South Africa or India or New Zealand or Australia. There are some really interesting initiatives being done around data-driven governance. This matters because the collection analysis of large data sets allows us to make fact-based recommendations and cut through potential distortions around bias or hype to really say factually what may be working for a population. And so collecting these data sets is vital. And so opportunities, we have seen really interesting opportunities and examples of donors acting in various geographies to be able to stimulate the system to be able to use data better and to set up systems wherein data can be used better by system actors. So setting up those data management systems within, preferably within government or within independent agencies that are able to support government, and then implementing consistent data collection and monitoring across funded programs. And I think this comes out very strongly in some of the, for example, the stunting work that's done across the region. There's some really important initiatives being done to gather data, but the insights we can get about the prevalence of stunting are really only as good as the collection of information about stunting itself. So that emerged as a key bit of advice from individuals we spoke to who are experts in this area, is that getting better information about an area such as stunting and ensuring that we have that consistent collection is very critical. You can move on. Also, this point about coordination among stakeholders and system actors. This matters because it ensures that families are benefiting because they have easy and consistent access to services, but also reduces inefficiency and wasted resources. This is something we see straight across geographies. You will have seen it come up in Esther's presentation, whether it's talking about what's going on in China or in Singapore. So the geographies at the opposite ends of the poles in terms of size and system complexity. And this is not uncommon, particularly in early childhood systems, because early childhood is a sector that often falls between departments or purviews. So we don't have departments of early childhood development. They often sit within health or family services or education. And so that cross-sector coordination is really vital. And coordination across the ECD sector on the ground is an important opportunity for donors to be able to support. I think we've seen examples such as in Indonesia, the cross-governmental work on stunting has been really powerful in terms of bringing the agencies together on a single purpose, and is an example that can be emulated in other places. Let's move on. The point about well-trained workforce and community recognition, I think this is a common issue globally, that often our early childhood educators and healthcare workers may not be the individuals who are as well-trained as they could be. Those roles may not traditionally be associated with high levels of education or with long retention. And so a stable, consistent, well-trained workforce across a variety of early childhood sectors allows us to have that consistent and high quality support to be able to work with children and families. And so regional exchange on best practices in workforce training and developing communities of practice across practitioners. There are also some really strong efforts in place to supplement and support the work of government around certification of early childhood educators and training of community health workers, which are really powerful tools. Can move on. This is a key finding in the region, is that probably an unsurprising finding given the work that we have been doing as Center for Evidence and Implementation in this region for some time, is that our evidence base globally is really still very biased toward the West. So we have a lot of evaluations rigorously done coming out of universities in the United States and in Western Europe. And we have a less well-established evidence base in the Southern Hemisphere and in this part of the world in APAC. And this matters because the lack of regionally specific research, context matters a lot to how programs operate. And that's an easy thing to say, but once we start looking at how programs actually work in context and the degree to which context matters for program effectiveness and its implementation, this means that locally conducted research that is looking at program contextualization is really vital. Things that work in London or in rural India might not work as well in the countries that we looked at in this study. And so we would strongly urge donors to be supporting independently conducted evaluations for local and regional programs, and to support the regional evidence synthesis on specific topics. So to be building up that regional evidence base so that we are more able to make evidence-informed decisions. We saw in some geographies, there were as low as 5% of the evaluation of the programs that we looked at had been evaluated, and those evaluations made public. So it's really important that we continue to build up that evidence base, and especially among donors, start to build a culture of openly sharing what we're learning so that the sector can advance and accelerate as quickly as possible. We can move on. Also then enhancing a policy and regulatory environment that centers the needs of children and families. And this matters because in ensuring that these policies are in place helps us to move away from the siloed structures and toward consideration of a whole child development. And this would mean supporting the exposure and introduction of ECD research to policymakers. Often what we see in a lot of the study countries is that there is a very strong, well-established central government commitment to strong policy reform in ECD, and that the policy implementation at the local level is a challenge. And that's often because local level policymakers are weighing up decisions about many things to do, and they may not have the insights about why early childhood development is so important. So it may just not be on their policy radar yet. And I think we'll hear from BVL about their experience a little bit later in how they've managed to get ECD onto the radar of so many policymakers globally. And engaging policymakers and stakeholders in a regional dialogue on a specific ECD topics is something we would also strongly recommend. So let's move on to questions and comments. I'm aware that we have a limited amount of time for this, so we'll turn over to Stacey and she can let us know what we might have the ability to cover off.
Yeah, thank you so much, Mary and Esther. I know there was a lot of information for everyone to cover. And also, I have to apologize on behalf of the team here on some of the technical glitches earlier on where people couldn't enter. So I think most of the people who have retried now and they're in. We have up to about 190 people again. So that's good. In case, some of your colleagues or friends have mentioned to you that they have trouble signing in, please let them know everything is fine now. Again, apologies for that. So I think we have just a couple of questions for Esther. And because, as Mary mentioned, we are short on time, so after that question, we will have to move on to the next speaker. So Esther, there was a question on how in China, a lot of the community-based child welfare personnel were people who were formerly working as expediters of the one-child policy. Was this identified as an issue? Also, David mentioned about how for children under 3 years old, there is a gap in many countries between 18 months and 4 years old with regards to their immunization booster. Do you believe one visit per year is adequate? And then about the attendance of the child visits. Well, I'm not sure whether these are questions for our research to cover, but Esther, I'll let you answer.
Sure, I'll try. I think on the second question, which is on well baby and well child visits, I think the main point here, which is also talked about much more within the report itself, is how can we improve what happens within the visits as opposed to just a conversation around the number of visits. I think there's reason for both, but one of the key recommendations that we've made within the paper as well is how can we train the workforce such that the time that they have with the parent, with the child in the visit is effective, not just looking at more or increasing the number of touch points, because if it's not meaningful, parents are also more unlikely to come back, especially if they don't see a reason for it other than immunization or getting a regular checkup. So yes. And to the first question, Stacey, I actually didn't quite get the question. I know you're talking about the one-child policy, but I wasn't sure what the question was.
Yeah, I think they were asking whether it was identified that a lot of the community-based child welfare personnel were previously people who were working on the one-child policy, and if that has been identified as an issue. Yeah, I mean, I think there's a lot of assumptions that go with this. So yeah, again, not sure if
I'm not sure we're best placed to answer. That specific point did not surface within the research that we had done, but also just to note, we were looking much more at the current scope of programs that are in place and the current scope of policies that are in place. So I'm not sure I can answer that in detail.
Yeah. Thank you so much, Esther, for trying, right, with these rather complex questions. Thank you also, Mary. Unfortunately, as I mentioned, we do have to move on to the next speaker, but I think both Mary and Esther have given us so much food for thought, especially for the discussions that we will have later for the country breakouts, right? So now moving on to Rujda Majid from the Van Leer Foundation. The foundation has been working on ECD for actually over 50 years, and I believe we can get lots of inspiration from their work across the world and perhaps leapfrog our progress in this area too. So again, before I pass the time to Rujda, I'd like to remind everyone that if you have questions, please type them into the chat box. Even for questions to CEI, you can still type them into the chat box or reach out to us. And after this event, we can continue these conversations, right? Over to you, Rujda. Thanks.
Thank you so much, Stacey. And if I may say that it's a pleasure to be here and pleasure to be here with like-minded organizations, foundations, representative from other partner organizations. And I'm really looking forward to this conversation and the question at the end. Thank you to APC for inviting me and the Van Leer Foundation for discussing a little bit about how we think about some of these topics and how we've kind of thought about scaling for impact in particular. And one thing I must say is, as I was listening to Marianne and Esther on the research and some of the recommendations that came about, it's interesting because these are some of the things that we have been working on as part of our last strategy, and I'm looking forward to sharing this with the audience. So with that, I will just dive into the presentation. I believe we have 30 minutes, and then I'm happy to answer any questions. So in terms of the Van Leer Foundation and in terms of this particular presentation, I'll just go over very quickly about in terms of who we are and why we do what we do, but more importantly, how we do what we do, in particular in thinking about scale and thinking about scaling for impact. And finally, I will lead you through some country-specific examples, in particular, some of the initiatives that we have done with the government in India and how that has scaled. And of course, again, open for questions later on. So in terms of the Van Leer Foundation, for those of you who do not know us, our mission is to contribute to inclusive societies where all children and communities can flourish. We are a Netherlands-based organization that works around the world. We believe that giving all children a good start in life is not only the right thing to do, but also the best way to build happy, healthy, and prosperous societies. Moving on. And so we work in a number of ways. We provide investment and knowledge that is specifically geared towards leaders and leaders in government, but civil society as well as foundations to think about effective policies and programs that will benefit children, in particular from pregnancy to age 5. And we can move on to the next slide. And in terms of why we work on Good Start for All Children, these are the values that we hold very dear as part of the foundation. Of course, we know that early experiences lay the foundation for many things later in life for a child. We believe that these lay the foundation for trust. We believe that investing in early childhood is also fair because it helps reduce gaps in health, education, income, and a range of inequalities that children may face in different circumstances. And of course, there is a focus on connection, on focusing on the needs of young children and fostering connections between not only the child and the caregiver, but also across society in terms of people that will work on this topic. And the foundation, a little bit of history. The foundation was founded in 1949. And in 1965, we decided to pivot to early childhood development. And there are a number of reasons for this, but in particular, one reason is that Bernard Van Leer, the founder of the foundation, and his son, Oscar, were businessmen. And they believed that they wanted to endow their wealth. And there was some early research coming out in the 1960s on why investing in the early years will have a disproportionate impact on children later on in life, especially in terms of brain development, in terms of neural connections. And being businessmen, they decided that potentially the best use of their investment is focusing on the early years. So in the 1960s, particularly 1965, the whole foundation, which had been working on a number of topics earlier, pivoted to the early years and early childhood development. And so since then, for now, nearly 60 years, we have been working on one topic with a single-minded focus, that is early childhood development. And of course, we come at it from different angles in different sectors. I'll talk about our cities work and also a work on parenting and responsive caregiving. But throughout the past decades, this is the one topic that the foundation has been focused on. Next slide. I don't need to mention this to many of you. All of you know this and are focused on this particular topic, and that's why you're here. Just to mention that we focus disproportionately, if I may say so, on the under 5. So we look at interventions that are focused on from pregnancy to 5 years. And of course, a lot of evidence and research supports that. And to say that increasingly we are becoming hyper-focused on the 0 to 3 years for all the arguments that all of you know related to brain development and so on. Next slide. The one thing that is that has been part of our work throughout, but is going to be really a focus as part of our new strategy, which launches in 2024, is focusing on caregiver well-being. And of course, we all know this, that parents and caregivers are crucial for early childhood development. But we saw post-COVID and post the pandemic that there was a disproportionate pressure on families and caregivers to be able to cater to the needs of young children. And therefore, moving forward, not only are we going to focus on young children, and of course, by definition, therefore, you focus on caregivers, but also on the caregivers themselves that are critical to the earliest experiences of young children and also beyond. I've already talked about this, but just to say that our work is increasingly focused not only on funding, which we provide to our partners and investments, but also to develop and share knowledge that we believe is critical to be able to scale ideas and to be able to scale knowledge across the world. In terms of how we work, and I'll get into that a little bit in the next few slides, but just in terms of geographically, we take a global perspective. And we work in a set of 5 core countries. These countries include the Netherlands, of course, where we are based, Israel, Jordan, and we work in India and Brazil. And we choose these geographies for a range of reasons, some historical, but also in terms of relevance and in terms of understanding where we can gain the maximum insights to be able to then share that knowledge across the world. We also work through 2 global portfolios. One that is focused on displaced populations, and this was a portfolio that we started as part of our last strategy, and really looking at how to support young children and their caregivers in situations where there are displaced families, which is increasingly something that we're seeing globally. The other portfolios is a new one that we are working on right now. And this particular portfolio is called the Foundations Leadership Portfolio. And here we are working with foundations as anchor partners, foundations that are based in regions where they have a long-term presence and local connections to be able to support them with knowledge and expertise that can allow all of us to scale with our knowledge and expertise across these particular geographies. And in this case, we would not have teams on the ground. So this basically encapsulates our philosophy at the moment, which is of how we work. So the foundation has worked, of course, as I mentioned, for the past decades on early childhood, but it has, we realized a decade ago, been able to influence our work, has been able to influence large number of policies, but also in terms of implementation has been limited to children that are maybe in the hundreds of thousands, maybe close to 1 million, but we've not really been able to achieve scale. And so, our operating model, if you will, specifically focuses on how to reach scale. And so therefore we pivoted our entire foundation since 1915 and as part of our last strategy to really focus on what it means to work on scale. And that meant not only changing the foundation internally in terms of how the foundation really brings the people on board with the relevant expertise and how we think about scale, but also externally on who we work with. And our work was focused and is going to be focused moving forward to a great extent in terms of working with government. And so, our operating model was working with government to be able to partner with them and working with other partners to be able to make a difference in the lives of young children. The one reason in terms of working with government was that government is already working at scale. It is already reaching a large number of families and young children. And therefore, as a small foundation that doesn't have the the resources that a government may have. Our value add was to partner with them and to be able to really bring cutting edge knowledge, research, and ideas that would be able to shape their work on early childhood. And we believe that we were able to make a lot of progress in the past 7 years. And now, and of course, we worked with other parts of the other sectors as well, but now we are really focusing on scaling this model to work with business in particular, to work with other foundations, as I mentioned, with the foundation's leadership portfolio. And of course, civil society has been our partner throughout, through the decades. And so this really leads into the idea of it takes a village to be able to raise a child. And we're saying that it takes a village to be able to scale early childhood, to be able to reach the maximum number of kids across the world. So we support our partners to find ideas that are best suited to their context. And I mentioned that we do this, of course, with funding and investment, but more importantly, with knowledge and technical assistance. We also work on advocacy and have been successful in terms of working with partners and shifting policies in a large number of countries and contexts. Also specifically on policy design, if that's an expertise that is needed by our partners. And there are two things that we have increasingly started doing over the past 7 years, which is focusing on executive education and study tours. And these are in particular to be able to bring policymakers and other partners in business and foundations to settings where they can benefit from ideas and people that have been thinking about these things for a long time. And study tours in particular, where we've implemented or governments have implemented or other partners have implemented interventions, because showing rather than telling often works much better. And of course, we then document and share these learnings across the world. So that is how we work with partners, and that's how operationally we've shifted to be able to really focus on this idea of scale and how do we work at scale with our different partners. We can move on to the next slide. So in particular, there are two programs that I will like to touch upon today. One is called, one is part of our cities work, and the other program is on parenting. And I will explain a little bit about why we do this. In terms of our cities work, I just want to mention that we increasingly realize that cities are very important and useful entry points for the work that we want to do with kids. And of course, this is supported by large demographic trends, which all of us know, where cities will have a high percentage of people. And I think there are a number of projections, about 50% to 60 to 70% of the populations being in cities. And so that was a realization that we had about 7 years ago. That was our last strategy. And we said that we really wanted to focus on where the maximum number of children were. And that's what led to our cities work. Of course, most of us know, and this number is by last count, I'm sure that this number can be updated, but about 250 million kids under 5 that are in cities at the moment. And of course, now we are seeing displaced populations and so on as well congregating in cities. The other idea with our cities work was that usually we work within early childhood with people that have been working on early childhood for a long time. And we thought, why don't we think about working with people that have not been working on early childhood at all, but have a disproportionate impact on young children. And so in terms of our cities work, we said, we took this question that you see on your screen, we took this question on to city managers, city leaders, architects, designers, urban planners, on if you could experience a city from the height of 95 centimeters, which is the average height of a healthy 3-year-old child by WHO standards, what would you do differently? And so this is a question that forms also a core of our future strategy, asking this question of anybody in any sector. If you were to experience your work from the perspective of 95 centimeters, what would you do differently? And this formed the core of our cities work. Next slide. So we call our program Urban 95 centimeters for the reasons I just described. And of course, at the heart of Urban 95 are dynamic and committed and cross-sectoral partnerships. And cross-sectoral work was mentioned by Marianne earlier, as well as part of the research. And this is key to our work in cities, because of course, the child as a whole, the child is one, and the experience for a child and also for the family should be seamless. So we work with a number of city departments and different agencies to be able to provide an experience that is holistic for a child and not divided up into an experience through the Department of Transport or the Department of Early Education or Nutrition and so on. At the moment, Urban 95 reaches 83 cities across the world. But also we are working with different partners such as the London School of Economics. And I mentioned the executive education courses earlier. We have an academy at LSE, which is called the Urban 95 Academy. That's our executive education course at LSE. And there we offer training and learning to leaders that are committed to working on this topic. And of course, we are working with strategic partners that are focused on urban across not only different cities, but global partners as well. So with Urban 95, basically we ask these questions and this question that I just mentioned, but then we also work on a number of things such as public spaces, such as data-driven decision-making, which was also a gap that was mentioned earlier. We work on looking at streets and playgrounds and parks. We look at access to early childhood services. We really kind of focus on how that experience of a city can be conducive to young children and a family so that they're able to reach their maximum potential. And so if parents, and the premise is that if parents and other caregivers are able to take their children to parks and playgrounds, be close to nature, are able to access services that are needed in terms of health and nutrition, are able to really have clean air and are able to have access to public spaces that will strengthen not only the brain connections that we all talk about, but also connection between the caregiver and the child, also connection with other caregivers and with the community. Next slide. And I think this slide will give you a snapshot of what I just talked about in terms of different cities that are around this world. This network is fast growing. And so as the next phase of our strategy, we are trying to figure out how to meet growing demand and how to be able to continue to spread this knowledge through different partners. So moving on to a particular example, and I think this may be more relevant to the context of our partners who are here and the different foundations and representatives that are here, is looking at India. And so as I mentioned earlier, we work in India, and of course there are other examples from many of our countries. So if you feel that other contexts are also relevant for you, I'm happy to talk about that or connect at a later date. In terms of Urban 95 and our cities work, we have a partnership with India's Ministry of Housing and Urban Affairs. In India, how we approach this work of scale is quite an interesting journey, but also to give you a little bit of context on India first, is that in India, we have about the population, many of you will know, is 1.4 billion now, and we are one of the largest countries population-wise in the world now. There are 4,000 cities and towns of varying sizes in India, 300 cities with a population of over 1 million. And of course, we have what we call metropolitan cities with population over 10 million, some close to 20 million. And we have about 28 states and 8 union territories, which basically mean that there is a lot of diversity in the country in terms of the different kinds of solutions you can bring to government. So this, what we call the Nurturing Neighborhoods Challenge, is a national scale program with the Ministry of Housing and Urban Affairs. And in India, how we approached this work was that we basically decided to lead with ideas first, which meant, and you'll see a slide later on really working through and thinking through a framework of what it means to work in a city in India. And we decided that looking at it from a neighborhood lens is actually the best way to do this. And neighborhoods are where I mentioned parks, playgrounds, access to services, but neighborhoods are where all these services should congregate for this to be a pleasant experience and a stressless experience for young kids and their families. And so hence the name, the Nurturing Neighborhoods Challenge. And the other realization for India was that once we worked on this particular framework, and this framework basically looked at, from a neighborhood scale, safe, inclusive, green, and there were a set of characteristics that we defined for neighborhoods. And so once we developed this framework in collaboration with the ministry, we decided to test this or experiment with this in what we called lighthouse cities. So this is not mentioned in some of the slides, but to give you an idea that we tested some of this in 3 cities in India of varying sizes, in collaboration with the government and in partnership with all of the city governments. And once we had enough evidence of how it was working, not always successful all the time, but how it was working, we decided to partner then with a particular platform within the housing and urban ministry called the Smart Cities Mission. So the Smart Cities Mission is a program that was launched in 2015 by the Indian government, which includes funding, a large amount of funding to Indian cities to be able to improve the quality of life of young children and their families. And so we basically partnered with the government on that particular platform, because we knew that as part of scaling, we could bring a particular set of ideas and knowledge and expertise, but that platform with funding and with this push from not only the national government, but also from the city governments themselves was critical to be able to scale. And so that was kind of the framing of how we thought about scaling for impact with a national ministry in India. And so what we did was that, and we can move on to the next slide, is that we launched this particular initiative, which we called, actually the urban ministry called, it is very much a government initiative. And I'm using we as a partnership. There was also a technical partner, is a technical partner involved. And the NNC, or the Nurturing Neighborhood Challenge, was basically launched about in 2021, and we opened it as a competition. This was a 2-step competition model. The Smart Cities mission is geared towards 100 smart cities. We opened the competition to all of the cities in India, but in reality, because the platform was the mission, it was more conducive for the 100 cities to apply. And out of those, in terms of the competition itself, being a 2-step challenge, we expected a large number of cities to apply and then work with them on what we called a short semi-final or a good to great phase, to be able to refine some of their applications. And then from that list of cities that applied, we would choose about a smaller subset of cities that we would work with in a more deliberate fashion for the next 2 years. And so initially 63 cities applied, and we then worked with these 63 cities. They then went through a judging process, out of which we selected 25 cities. Again, we meaning it was an independent jury actually at this point. And over 7 months, these cities received technical assistance, capacity building, and worked as peers in terms of this learning phase. And this was and this support was provided by WRI, which is our WRI India, which is our technical partner, in collaboration with the ministry and us. And so then in 2022, which is last year, the winners from the 25 cities were announced. And so then those 10 cities we are working with now quite deliberately to be able to provide them with visits and study tours, as I mentioned earlier, executive education courses, very targeted technical assistance, capacity building for the early childhood workforce in particular. Also, one thing that was mentioned earlier as part of the research. And of course, we realized that the learning happens not only through facilitating this through one partner or through us, but between the cities themselves. And really, there is a lot of focus on cities forming the networks and their connections. And I mentioned connections earlier as one of our values, to be really able to connect. If we move to the next slide. Just quickly through some slides, because I wanted to also talk about parenting. So in the interest of time, this is how the cities worked over the 7 months. And you can see that a lot of it are strategies that many of you will be familiar with. The first step was to identify quick wins and to work on low-cost temporary interventions that they would be able to show results, build confidence in different people and stakeholders that would be involved, and engage communities. Next slide, please. To be able to co-create these solutions, and a lot of, again, stakeholder consultations, also with city officials, also with communities, also with frontline workers. What you see with the group raising the yellow and the pink papers are frontline workers. Next slide. Data is indeed a problem across the world. This is a major issue when you're talking about local level and when you're talking about neighborhood scale, and therefore there was a lot of need to be able to work on this with cities. There is both lack of data, lack of capacity, and lack of incentive to be able to collect data. So this is an ongoing push in this work. Next. And trialing different solutions. And you can see that these are not very elaborate, but low cost. At the top, you see one particular, this is a vaccination center, and to make it conducive for young children and families to be able to come to these centers, to be able to have places to rest, some shade in some of these slides so that families and caregivers would feel welcome. And so this is just some statistics on how we did over the course of the 7 months, and this happened across the country. Next slide. And so you can see a little bit here in terms of the different cities involved in this map, and really the large footprint that came about from this particular initiative. Next. And I mentioned this a little bit already, but this year we aim to complete this. In reality, I think we will continue working with the cities moving forward as well, but really to work with these 10 cities in depth to be able to really think about policies and funding and capacity, some of these core conditions, as we call them, for scale and sustainability that will embed these ideas and principles in the way the cities, but not only the cities, the communities work on or demand early childhood. Next slide. And so just very quickly in terms of some strategies that have come about over the past couple of years of working on this is really thinking about not only showing what works, but thinking about institutional setup, thinking about a diverse range of partnerships, thinking about funding, thinking about really civic engagement, data, a challenge, but has to be done, and embedding a lot of this thinking in plans and policies. Sometimes policies are not always possible. It's hard to do this at a city level sometimes if some of the power rests with states, but then you could really work on guidelines that can become the norm for cities. Next slide, please. And so just that there are a number of knowledge products on this and other guidelines that we've worked on across the world that are available on our website. And of course, we'd be happy to share with APC and others. Next slide. And I have about, I think I have a couple of minutes left. So maybe just to say on our parenting work, and we can move to the next slide. Is that here we have a similar strategy of working with government and working with other partners, but really embedding the parent coaching piece of the work, which is a very specific responsive care piece of the work on existing government services. So the plus is layering on parent coaching to existing government services that may be through health, maybe through the private sector, through health insurance companies, or could be through early learning and some of, or nutrition programs. Nutrition programs are key here as well. And training the early childhood workforce, health workers that really work directly with families to be able to combine this element in a cost-effective way. And so that basically then rides on the government system that is already there. Next slide. And these are a number of partnerships that we have at a national level in most cases across the world. Next slide. And Ministry of Health, again, in India, we partner with the Ministry of Health. Palan 1000 or 1000 is the name of this initiative, which means Nurture 1000. And the concept is similar to what I just described and really includes a campaign across the country, an app that is in use now by many of the 28 states in the country, training, and also includes to the point earlier that was made that there is lack of data and evidence that is more local. Here really looking at, in a different way, I think slightly cultural parenting practices, which and research on that during the first 1,000 days. Next slide, please. And so just that quickly, this is an app that the ministry is using that we've worked with. And really, it's one of the interesting pieces of this work on how you really then work with frontline workers to be able to use this app with families, many in very low income and disadvantaged backgrounds. And so, so really to make it as graphic heavy as possible, to make it as simple as possible so that the message is delivered quite simply, and so this is, we are learning from this as I speak. This is something that we are working with the government now. Next slide. And finally, this is the final slide that I have, which is that in terms of thinking of implementation at scale, which is how we really pivoted our entire strategy over the past 7 years, and for the foreseeable future, we will continue to work at scale. We know that it takes many people, many partners, cross-sectoral approach to be able to scale, and that's where we will focus our energy. Of course, the backbone of this is with families and frontline workers, and they're under a lot of pressure, and how we can relieve this pressure, because of course that's what supports the child best. I mentioned this with our parent coaching or the Parents Plus work, which is, and also with Urban 95 and the Ministry of Housing work in India, which is built on something that is already existing, we have tried to stay away from creating something new. And also with scale, we come across challenges in terms of course, quality, in terms of sustainability, in terms of inclusion. We have not mastered this. We are still learning, and we will continue to work on this as part of our next strategic cycle. We work in 5-year strategy cycles. But to say that we've realized that whatever you scale should be as simple as possible, to be able to really make it easy to be adapted in different contexts. So I think that is the final slide. We can move to the last one, maybe. Yes, so with that, many thanks. I think I'm 4 minutes over time, so my apologies for that, Stacey, but I'm happy to take any questions in the remaining time. Thank you.
No worries. Thank you so much, Rushda, for opening our eyes to ideas on scaling up and really integrating child development into other areas. I think we really have one question, that came out a couple of times in the chat boxes. If there are organizations that are interested to get involved in Urban 95, is there a way to do this?
Sure. So one thing I'll mention quickly is that the Urban 95 Academy actually is not limited to our direct partners. And it's open to to teams that may wish to apply. In most cases, we've had applications from city governments. So it is an academy that is geared towards cities. And so any city is welcome to apply, and cities can partner with other stakeholders within that city to be able to apply. So it's not something that is limited to either people we nominate or people that LSC nominates. So that's one open forum, and we are looking to expand that as actually very soon in terms of also thinking about this a lot more reasonably. So that's coming as part of our next strategy, but the academy is open. In terms of direct partnerships, we have this with, as I mentioned, 83 cities. We are finding that there are limitations to our own kind of team and resources in terms of how we do that. So we are thinking about ways in which we work with large organizations or network partners, as we call them, to be able to do that. We will make this information available over time on how to partner with us. There are a lot of knowledge resources available on our website. And of course, we encourage you to get in touch, because as we create some of these ways of being able to benefit from the learnings of Urban 95, we would love to already hear from you so that we can include you in the work.
Thanks so much, Ruchita. So am I right to say that Asia will also, I mean, other countries in Asia besides India will also be in the purview of the Family Foundation? And if the audience here that are interested and are not part of the government, if they're interested in this, they have to work with governments to apply. Is that it?
So in terms of the Urban 95 Academy, yes. I think as part of our new way of thinking, and I outlined that with our strategy on working with business, with foundations as well, is that that we will find ways in terms of people that are working with business and are scaling, or foundations that are looking at other ways of scaling, or are just looking for knowledge and expertise as part of their own strategy. We're happy to provide that. I would encourage them to then get in touch with us, and we'll find ways to support that.
Super. All right. Thank you so much again, Ruchita. Thanks for joining us all the way from Romania today, I know.
Thank you for having me.
Thanks. So we'll have to move on to our last speaker now. And she will be sharing what many of us have on our minds. How do we take these research findings and help to move them towards policies and translate into better practices for real impact, right? So let's invite Dr. Robin Milden, CEO of Center for Evidence and Implementation, and holding a joint appointment at CHAL at NUS, to share some cases from the ground. Over to you, Robin.
Thanks, Stacey. And hi, everyone, and thank you for inviting us to speak. I need to appreciate Stacey a little bit, that she's put me between you and a break. So that's a clear signal that this needs to be at clip speed. So I'm Robin Milden. I'm the CEO of the Center for Evidence and Implementation, and I have a joint appointment with the National University of Singapore, and I'm affiliated with a bunch of things we're doing in Singapore. Before I start the talk, which will be focusing on how to accelerate the use of good evidence in policy and practice, and how do we do that in early childhood, I just want to invite Adrian Sandler, who's come on the screen here, who's the Executive Director of CHILD, the center that Stacey introduced earlier, and just have Adrian take a couple of minutes to introduce what CHILD is, just because it's a fabulous new initiative supported by a number of partners. So over to you, Adrian.
Thanks, Robin. Thanks, and good afternoon, everybody. And just very briefly, on behalf of CHILD, our sincere thanks to Esther and Mary and Gayatri and the whole CEI team who conducted this very comprehensive and important work. And thanks also to APC and the other funders for their generous contributions. Next slide, please, Robin. Thanks. Yeah, so CHILD was established at the Yong Lu Lin School of Medicine with a generous endowment from the Lien Foundation. And it was really founded precisely to bridge this gap from evidence to policy and practice in early child development in Singapore. And as you can see here, our core strategic partners are CEI and the Singapore Institute for Clinical Sciences, SICS. And so CHILD really offers the complete package of translational research and early childhood development and implementation science in order to try to address these gaps. Next, please. Our mission, as you see, is to improve outcomes for all children in Singapore by accelerating translation. Next. And this is how we aim to do it. Our primary stakeholders are policymakers and the practice sectors in early child development in Singapore. And through these 4 key interrelated work streams that you see listed, we aim to impact policy and practice. And really, this landscape study is just a great example of that, highlighting strengths and gaps in early child development in Singapore in order to guide collective action. So Child will engage in translating and communicating the findings to leaders in policy and practice, and considering strategic opportunities to work with our partners and stakeholders in trying to bridge these gaps. So that's really all I had to say. Just congratulations on the launch, and over to you, Robin.
Thanks, Adrian. Thank you very much. That's terrific. And I just want to emphasize CEI as a partner in a couple of initiatives, including Child, which we're very proud of, but also just to acknowledge the another center that we are partnering and are working together on in Singapore, the Behavioral and Implementation Science Interventions Center. And just to acknowledge Professor Nick Saldalis, who is the director and academic director of that center, has joined us as well. And there's quite a good overlap in terms of the things that we're establishing in Singapore locally to sort of take some of the work in early childhood further. So thank you. Next slide. I'm going to go at a clip. In Australia, what we mean by that is I'm going to go fast. So I've put a deck of slides together that I'm not necessarily going to go through all of it in great detail, but because you'll be getting, I think either you have the slides or you'll get them later. I wanted to still provide some content and context to some case studies that I'm going to show you. So some of this I'll skip and some of this I'll stay with. So this is really why the CEI and the work of our partners exist. It's a fundamental, very practical idea. We cannot benefit from things that we do not get. And all the promise of evidence and innovative models and practices and approaches won't be realized and won't benefit the people that we all serve unless we are able to effectively and efficiently implement them in policy and practice. Luckily, there's a little bit of research and science behind this that I'm going to draw on because people are very interested, and there's a number of you that have seen some of this presentation before. So again, this is why we're all here and why the landscape study is so important. Next slide. So implementation and bridging the gap between evidence and policy and policy and practice back to evidence is a real challenge, because change is really hard and we all know that. And often we have misimplementation or poor implementation for a number of reasons that I think will be familiar to most of the audience. We lack the data to understand, are we implementing well? We may not plan as well as we could up front for our implementation efforts. The skills of, if it's a workforce strategy, the skills of the workforce don't quite meet what the program, practice, or innovation needs to do. And turnover and management challenges and organizational challenges can really get in the way of bridging that gap. Next slide. And so what I'm going to talk about from here on in is this area of research and science called implementation science, which is simply the study of what gets in the way and what helps achieve effective implementation. And what I mean by that is that something goes from an innovation and a new idea to business as usual. And the act of implementation is just being very focused on what activities we need to do to get something effectively implemented. So again, just think of it as a bridge. Next slide. And so what we know also from the research and what we know from our own practical experience at CEI and also the work that Child and others do is that making it happen is what really counts. Helping it happen by diffusing and sharing is important, but insufficient to be able to really embed innovations into systems and policies and practice. So we talk about active implementation. Next slide. And what we used to think about is that if you had an effective innovation, a program, a practice, a policy, all we would need to do is just simply what we call spray and pray, get it out there, hope it happens, and that we would get improved outcomes. But what we've learned and what we all know through our day-to-day practical jobs, but also through research, is that it's a little bit more complicated than that. We need something that works, but also we need to implement that well. So effective practices plus effective implementation. And as Mary said earlier, context really matters. It very much matters. And this is very important for the work that we're doing in Singapore and the region. Next slide. And if you just think about if the what is the innovation or the practice and the how is the implementation strategies, what you're trying to do is use implementation strategies to overcome the things that are getting in the way and the things that could help achieve that effective implementation and actually get the outcomes that we're looking for. Next slide. I'm going to go so fast. And this slide here is just a cue for me to say here that, again, context matters. And in early childhood and early childhood systems and services, we need to be a little careful. And again, Mary touched on this, to understand that not everything is transportable across countries or culture. So because something worked in the United Kingdom doesn't necessarily mean it's going to work in the Philippines. There needs to be some adaptation. There needs to be some local contextualizing, and maybe it's not even matching the need that's there, which again, the landscape study is going to help us all understand better. Next slide. And this is just getting at, again, when you're thinking about implementation, you have a what, an innovation, but there are a number of things you need to consider in the how. We generally think about them as implementation strategies. We need to be thinking about what training people need, but in addition to training, what additional strategies will support the effective implementation. We need to be thinking about the environment that it will be implemented in. We need to be thinking about the communities and the systems that we're implementing in. Next slide. And this is something we call the 3 eggs. It's actually called the Dynamic Sustainability Framework, which is a terrible name. So I just prefer 3 eggs, and the developer of that doesn't mind. But the point of this is just for everyone to think about when we're trying to implement into context, into countries, into communities, it's about finding the fit. And really those arrows should go both ways, where we may have an intervention or an innovation, but that really does need to fit within the practice setting in which it's going to be implemented, which in turn needs to fit with the wider system. And at times that needs to go back and forth until we find the right way and carefully do some adaptation without taking the effectiveness away from the intervention. We don't want to adapt to the point where the things that made it work aren't there anymore. But we want to make sure we're doing some careful adaptation so that it better fits with where it needs to be implemented. Next slide. Next slide. And so I just mentioned implementation strategies because there's a couple of case studies I want to highlight to you, but these are really the secret sauce of the how. And there's a lot of good research and practical knowledge now about what are our best bets in terms of achieving that effective implementation. And these are categories, but within these categories, there's numerous implementation strategies we can try. Of course, there's training, but there's also what else do we need in addition to training? There's evaluation strategies and data monitoring and using data to understand what's happening. There's changing the infrastructure within an organization or community to better help implementation. And those are all things that you sort of carefully identify to directly address the things getting in the way, the barriers to implementing the innovation, the program, the practice. Next slide. And this is just a shout out to measurement. So it's very difficult to do good implementation work without data to understand, are we reaching the people that we thought we would? Are we implementing in a way that we intended? And are we getting the outcomes or the change that we were looking for, the improvement? It is sometimes a little overwhelming to put measurement in its place, but it's something really, really important. And some of the things that in the circle that's there, people will already be doing. Most of us measure acceptability. How acceptable is the innovation in the first place? But we don't often really think about how feasible it is. Did we implement well? And how does that relate to whether or not we got the effect, the improvement we were looking for? So again, it's not always a research activity that needs to use data. We need to use data in every effort we have to improve and implement things. Next slide. And this is just, I'm not going to talk about scaling because the previous Rashta handled that quite well, but scaling is different to implementing more. And it has different considerations and different things that need to be thought through. And that's a whole other presentation that maybe we'll share at another time. So we'll go next slide. I have 4 case studies to share with you just to try and make some of this practical. The first one's Pakistan. So you can see the context there, all sorts of difficult political environments, floods, lots of awful things happening, children and families. The government, and often this again, context really matters. We get opportunities to implement things that have good evidence to achieve their outcome when the context is ready. So in Pakistan, there was a particular context that was ready for really focusing on improving maternal, newborn, and child health. And what I want to point about this case study, and I'll let you read it in your own time, is that rather than bring in a whole separate program and try to set up a system to implement that program, what they did here is they integrated an evidence-based approach to improving newborn and child health into its current existing healthcare system. That is the Lady Health Workers Network. And they did a really nice job, and the results really speak for themselves, of building that approach into an existing service, providing a training plus strategy. So they just didn't offer training once, they offered training a number of times, and plus they paired it with really effective supervision. And they, in fact, got improved engagement. The services were enhanced. And it's one of the things in implementation that we know is sometimes we should be integrating within existing services rather than necessarily always bringing something brand new in. Next slide, 3 to go, close to the break. This is I just wanted to highlight this is a program obviously in Jamaica. What's really nice about this from an implementation, that is bridging the gap between evidence, policy, and practice, is that they took active ingredients or practices that we know teachers can use in an early childhood context to improve children's behavior and improve the quality of their behavior management. So rather, again, than necessarily trying to import and structure a whole new program, they took a handful of practices that the evidence says would work and the teachers found acceptable, and integrated it into a way that the early childhood classrooms worked. And again, we had improved teacher well-being, we had improved behavior there. The process was very satisfactory to the teachers. And so it's thinking about how can we make the things that work to improve children's lives and families' lives fit sometimes within the existing system that we have. Next slide. This one is interesting, and I wanted to highlight this in that they really thought through quite carefully what are the implementation strategies. So they had a innovation or a what, and there's good evidence, and the Rashta really, unfortunately she raced over it, but responsive and sensitive caregiving is really, really very good for children. And what they did is they had an existing curriculum and they did an adaptation. So it was something from another place and they took it to another country and they adapted it for that country very carefully. And then they measured whether it would work. And what they found was the visitors, the workers, when they had something to work with, a model that they could bring into the work they did with families, their confidence improved. Parents engaged more with the approach. And that makes intuitive sense. When you've got something that works and parents are feeling successful, that really does. But I also wanted to highlight in this particular case study, the write-up highlighted that the staff turnover was a major challenge. And therefore, they had to use additional implementation strategies to overcome that. You train an entire workforce, they all leave, you're starting from scratch again. research and implementation has some solutions for us to try in real world settings to overcome the reality of that we will be working in places with high staff turnover, and there will be some things we can do ahead of time to address that, to improve implementation. Last slide. This is interesting. So this is a study to come. So this was an approach that has been trialed in Thailand to improve the reduce child maltreatment, which we're basically talking about child abuse and neglect, and improve parent mental health problems. And so what they did first is they trialed whether or not this innovation, this program, very low cost, light touch parenting program, worked in this context in Thailand. And they found that it did. So they did a nice, rigorous impact evaluation. And so what they've done, which I think is really important, is they've now taken it to another phase where they're going to ask themselves, now we know something here could work for families in Thailand. How do we get it implemented effectively? And let's evaluate that. And that is very unusual. Sometimes we evaluate a program and then we go, okay, job done. It seems to work. Off you go. Then we disseminate it. We put it on websites. We offer training. But what they did, I think, is very innovative. And it's the sort of work we want to be doing with partners in Singapore and the region. And that is, okay, so if this thing works again, what are the implementation strategies we think we need to use to get it used effectively, that has become business as usual and is implemented with a very high quality. And therefore, we'll be able to have a better chance of scaling, because we'll be able to answer not only does this program work, but it works when we do this kind of training with a little bit of coaching. Here's the data here that will help you measure it, et cetera, et cetera. So we'd be encouraging, myself and my colleagues in Singapore and the region would really be wanting to build up more implementation thinking, especially when we have innovations like that did seem to work for children and families. Next slide. Stacey. Oh, that's so we have a really big summit in October. It's online and in person. The Behavioral and Implementation Science and Innovation Intervention Center is one of our partners, as is Monash University, as is the Center for Evidence Implementation. If you like those case studies I presented, there's a lot more where that's coming. There's some thinking about how funders can contribute. And as I said, you can join us in Melbourne, which we would love, but you could also join online. So next slide. Thank you.
Thank you so much, Robin. And thank you so much to CHILD. I'm sure everyone will agree with me that that's a great acronym, right?
Yeah. We cannot take credit for that. I have to say that there's this very special person at the Lean Foundation that came up with that, and I will not name the person because she will, oops, I say nothing.
Okay, thank you again, Robin. So we have now come to the end of the public segment of these events. And would like to take the opportunity to thank all our speakers and again, the supporting foundations behind the research. And most importantly, all of you for taking the time today and asking some very pertinent questions too. As you can see here, you can also have access to the full report or the specific country chapters at our website. So you can scan the QR code displayed here to access directly. We encourage everyone to refer to the reports and give us any feedback. We hope this is only the start to many meaningful discussions and collaboration towards better results for the children.